Welcome to the Jason podcast. We are Namiko Goto
and Ismay van Loon
from Dialysis Center and University Medical Center Utrecht in the Netherlands. We are happy to present a summary of our manuscript entitled Association of Initiation of Maintenance Dialysis with Functional Status and Caregiver Burden, which has been recently published in the Jason.
Increasing numbers of older adults are initiating dialysis. A recent study showed that the top health outcome priority for older adults with advanced kidney disease was maintaining independence. This was rated even above staying alive. However, little is known about how functional status is affected by the start of dialysis. In this study, we assessed functional status in 187 older adults who were included in the geriatric assessment in older patients starting dialysis study. Functional status was investigated by assessing dependency in activities of daily life, such as bathing, dressing, and continence, and dependency in instrumental activities of daily life, such as shopping, house cleaning, and telephone use. We assessed their functional status at the start of dialysis and compared this to their functional status 6 months after the start of dialysis. Functional decline was defined as a loss of independence in one or more activities of daily life. Improvement was defined as a gain of independence in one or more activities, and stable was defined as a similar level of independence at the start of dialysis.
In our study population, the mean age was 75 years, and the majority of the patients started with hemodialysis. At the start of dialysis, 21% of the participants was fully independent in functional status, 52% of the participants was mild to moderately dependent, and 27% was severely dependent. After 6 months, 40% of the participants experienced a decline in functional status, 34% remained stable, 18% improved, and 8% died. Loss of functional status was mainly driven by a loss of independence in instrumental activities of daily life, such as medication intake, laundry, and food preparation. In addition, we included 92 caregivers in whom we assessed caregiver burden at the start of dialysis and after 6 months. After follow-up, we observed an increase in prevalence and severity of high caregiver burden. Hence, functional decline is frequent in older patients starting dialysis. Furthermore, the initiation of dialysis seems to be accompanied with an increase in caregiver burden. We hope our study results can help physicians, patients, and caregivers in their discussion whether to start dialysis.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.